Blood pressure is the pressure of blood pushing against the arterial wall. Arteries are the pipes which carry blood from the heart to the rest of the body. There are two numbers. The top number is called systolic blood pressure, which is created by pumping of the heart. And when the heart relaxes, you have the lower number called diastolic blood pressure. Anything less than 120 or 80 is considered to be normal blood pressure. And between 120 and 130 is considered to be pre-hypertension, and 130 to 139 or 80 to 89 is considered to be stage 1 hypertension, and anything more than that is stage 2 hypertension. Now, why should one be concerned about the high blood pressure? It's a major cause for heart attack, stroke, heart failure, kidney failure, and dementia. It affects nearly 120 million Americans. Unfortunately, only 24% of these patients are treated appropriately. Simple lifestyle changes can help reduce the blood pressure. If it is not controlled, you can take medications which are inexpensive, they're all generic, and all have shown to reduce the blood pressure, and which translates into decreased risk of heart attack, stroke, and heart failure. And there's a way to record the blood pressure. And one should be seated in a comfortable chair with the back resting and the feet on the floor, not crossed. The bladder has to be empty, should not have eaten anything or drank coffee within half an hour of recording the blood pressure. Should not be watching television or having any conversation. And the blood pressure cuff has to be put directly on the skin, not over the clothes. And one must take 2 or 3 readings and take average of those readings. The other ways of recording blood pressure is so-called automated office BP monitor. Here, the BP cuff is placed on the patient. Our medical assistant leave the room. Then the BP monitor automatically records 3 times and gives an average. That is a lot more accurate, and it helps diagnose white coat syndrome. What is white coat syndrome? The blood pressure outside is normal. In doctor's office, it's typically high. One other method of diagnosing appropriate blood pressure is called ambulatory blood pressure monitor. It's a 24-hour monitoring of blood pressure. And the patient goes home with it and sleeps with it. It also helps diagnose masked hypertension. What is masked hypertension? Someone who has evidence of any damage to the blood vessels or thickened heart muscle, kidney failure, or patient with sleep apnea with a normal blood pressure, then you get 24-hour ambulatory blood pressure monitor. Recording blood pressure appropriately is key in managing hypertension. You do not make a decision of diagnosis or treatment based on isolated readings in doctor's office. You have to have multiple readings over 1 or 2 weeks in diagnosing and treating hypertension and also adjusting the medications. The management of hypertension has 2 parts. 1, lifestyle changes. Number 2, medications. Among the lifestyle changes, the most important thing is adopting healthy diet. DASH diet stands for Dietary Approach to Stop Hypertension, which is nothing but vegetables, fruits, multigrain, less saturated fat. In addition, one has to restrict sodium. When you talk about sodium, many people believe that they do not use salt shaker. They think that they're eating low sodium diet. It is not true. So one has to be aware that 90% of the sodium comes from the food you consume, not from the salt shaker. The other components of lifestyle are maintaining optimal body weight. If they lose even 10 pounds, can lower the blood pressure as much as 5 millimeters. For every kilogram weight loss, you decrease the blood pressure by 1 millimeters. Exercise is another important component of lifestyle changes. One has to exercise for at least 90 to 150 minutes a week of moderate intensity exercise. Stress management is another important component of lifestyle changes. If you are high-stressed individuals, you need to be counseled, and you can practice meditation, yoga, which helps lower the blood pressure. And alcohol is an important cause for high blood pressure. If you consume excess amount of alcohol, it leads to hypertension. Over-the-counter medications do have an effect on blood pressure. For the most part, blood pressure can be handled by primary care physicians. If the blood pressure is not controlled, which is called resistant hypertension or refractory hypertension, then you can see a specialist. In closing, high blood pressure is very common. It affects 120 million Americans. Unfortunately, only 24% of the patients are treated to goal. Simple lifestyle changes can help reduce the blood pressure. If it is not controlled, you can take medications which are inexpensive. They're all generic and all have shown to reduce the blood pressure, and which translates into decreased risk of heart attack, stroke, and heart failure.